In wedding season, some people are really worried about potentially embarrassing situations like maybe excessive sweating. Dr. Joe Cohen from Aboutskin Dermatology is here to talk about the medical condition. Thank you for being here today.
My pleasure.
And you get stressed out or, whatever the circumstances might be, you might sweat a lot more than usual, but this is a condition, right? What's the medical name for it?
It's called focal hyperhidrosis, and we all sweat throughout our bodies to regulate our body temperature, and we all sweat throughout our bodies to really respond to anxiety in situations such as exams or a job interview. And there are some medical conditions that can cause us to sweat throughout our body, such as going through menopause or endocrine problems or infections or sometimes even cancer. But what we're talking about is really focal areas of excessive sweating, which usually occurs in the palms and the soles or underneath the arms, and this can be extremely debilitating.
So how many people actually suffer from this excessive sweating?
A new study from St. Louis University actually shows that about 3% of the U.S. population suffers from hyperhidrosis. Unfortunately, many of them don't realize it's a medical condition that can be treated, and they haven't sought treatment, and they feel very embarrassed by it.
Yeah, so deodorant doesn't even help in certain, obviously, when you can stain your shirt like that. So are there other treatments available?
So deodorants that have higher concentration of something called aluminum chloride can be very helpful. Those are typically deodorants that are labeled as clinical. So Secret Clinical is one example of that. And then,
can you get that at regular stores?
Yes.
Okay.
And then second line of therapy is going to see your physician for something called aluminum chloride, which is a high concentration solution, and people tend to use this on their palms, on their soles, or underneath the arms. It can be a bit irritating. Fortunately, there are other ways to treat this. For people who have excessive sweating on their hands and feet, there is an electric current device called iontophoresis, which can really be very effective for this. And then for underarm hyperhidrosis, it really doesn't work that well, and it's not really feasible to put it under the arm. So we go right to therapy such as Botox, which is FDA approved for underarm hyperhidrosis.
So speaking of Botox, is that really a permanent solution, or is that temporary as well?
Botox is a temporary solution. It is very effective. It really kicks in about 7 to 10 days. It can last an average of about 8 months, and it can be dramatically helpful for some of these patients to improve their quality of life. There are other therapies. There are oral agents that can be used, but these have a lot of side effects, including blurry vision or urinary retention or dry mouth. And there are actually some surgeries that can be done, but similarly, they can have a lot of side effects and can cause sweating in other places. We call compensatory hyperhidrosis.
Okay, but there are options that you can look for in the stores. Just look for what again for the deodorant?
They're typically labeled as clinical, and they're just, or they say high concentration aluminum chloride.
Okay, there you go. At least you can look for that too. All right, thank you so much, Dr. Cohen. We appreciate it. For more information on Aboutskin Dermatology, go to our website, thedenverchannel.com, and click on that big red TV button. We'll have a link there. MTV's